Good day everyone, my name is Christina Yumalino from BE2C. I'm here in front of you to share about the local and international government policies that protect the well-being of the person of the new technologies. So, communities operate in the context of federal and state policies that can affect local government decisions relevant to health through laws and regulations. Through the allocation of resources and by shaping political will on issues and approaches. Among the more widely recognized policies are those that fund or regulate healthcare delivery services, but policies in a very variety of areas, ranging from education to land use and housing, the environment, and criminal justice can be relevant to health disparities. Policies can vary significantly across geographic areas and over time in establishing priorities, providing funding, or encouraging collaboration. They can provide important opportunities of constitute barriers to promoting health equity. The policy context shapes the levers that are available to communities to address change. It seems reasonable to assume that the better informed communities are about the implication of federal and state policy and policy changes, the greater their ability will be respond effectively to address health disparities and help achieve change in the determinant of health. And conversely, the more the need of communities are considered in decision making at the federal and state levels, and more effectively those policies will be. In other words, policymakers have the opportunity to lay the groundwork for community success. So now I have heard the urban planning policy. Housing affordability and federal policies are part of a larger dialogue concerning housing that also includes land use, residential and commercial development, natural resource use, transportation, and even more broadly, changing neighborhoods and concern over potential residential disruption. So, urban planning policies shape the physical environment along with many other social determinants of health. Within federal and state initiative, community action can support local policy and implementation so that they benefit vulnerable population. Next, I have the education policy. The powerful role that education plays in producing or reducing inequitable health outcomes was discussed in educational attainment predicts life expect and such health status indicators as obesity and morbidity from acute and chronic disease. So the educational level of adults, particularly maternal educational achievement, is linked of their children's health and well-being. In our regions, in the regions of the United States, the gradient in the health outcomes by educational attainment has stepped over the past 4 decades, so producing a larger gap in health status between with high and low education levels. Thus, policy and practice increase academic achievement and reduce education disparities, make critical contribution to reducing health inequities. And, and also the civil rights law and policy. Civil rights, health, and environment justice has laws and policies provide a framework to promote equal access to publicity, funded resources, and prohibit discrimination based on race, color, national origin, income, gender, disability, and other factors. This cross-cutting approach can be applied across different areas such as health, park access, education, housing, transportation, and I'm here also a health policy, the Patient Protection and Affordable Care Act. So, the the ACA has changed the financing, organization, and delivery of healthcare services in a number of important ways. It not only expand private and public health insurance but also reform how Medicare and Medicaid service are delivered and revise the tax code in important ways that encourage non-profit hospitals to invest in their local communities in new ways. The following section briefly reviews selecting features of the ACA and discuss both how these features affect communities and how federal policy could be changed to affect health equity at the community level. Here, the last criminal justice policy. So, the criminal justice system plays an important role in shaping health equity through multiple mechanisms. The first, which is conceptual, straightforward, includes the healthcare screening and treatment service that the system provides to adult and juvenile prisoners and probationers. The second is more complex and far-ranging and includes the set of policies that determine if an individual becomes involved in the justice system, for how long, whether or not alternative sanctions will be offered, and how individuals will re-enter the community after incarceration. So these policies have long-term implications for education completion, employment, and income, all of which in turn affect health because the justice involved population is disproportionately people of color and disproportionately compresses other vulnerable population such as persons with mental illness, criminal justice. That's all and thank you.